Welcome to Be Confident Coaching Center. Today I am going to take the Oet Letter Introspection of 25th March 2023. The Oet letter was an unknown case and it was relating to the stomach cancer. So I am moving to the case notes. Actually, it's just a replica, so the same content is not being produced. However, let's move to the case note. So it was an unknown letter. The patient's name is James Mackay. He is 76 years old and the admission date as usual 8 January 2023. His social history was given. He was a widower, stays alone at home, retired as a local teacher in Melbourne. This is just a replica of the original letter, so the details might not be resembling. Recently moved to Australia after retirement. Address is being given. Past medical history is being given. 20 December 2022 initially presented with complaints of fatigue, stomach pain, indigestion, loss of appetite and unintentional weight loss. So investigations were conducted and advice for gastroscopy, CT scan, X-ray as well as biopsy. And he was diagnosed with gastric cancer and was scheduled for surgery on 26 December 2022. Surgery: he had undergone partial gastrectomy along with jejunostomy pump fixation for feeding. The nursing management post-operatively in the initial stage started feeding with the NG tube for administration of the nutrition and medication and gradually shifted to jejunostomy when the esophagus became completely healed and the surgery was successful. The urinary catheter was removed 10 days after surgery. Sutures were removed and the nasal tube was also removed. After surgery, he was nil by mouth. Thereafter, liquid food was given and then a small amount of soft food was given. The patient was managed conservatively during the hospitalization. Today, he made good progress and is ready for discharge. However, maximum assistance with showering and activities of daily living is required. Vital observation was stable and continued observation has been recommended. The discharge plan states that he requires dietary time to be monitored, assistance in jejunostomy pump feeding until his calorie intake is sufficient. His wound has to be kept clean and dry. Assessment of the surgical site and the drainage tubes has to be monitored to check for the signs of any infection such as redness or any odor, pain or swelling. Use a clean towel to clean the skin around the J tube. Consult the doctor if there is any bleeding around the tube, leakage or the stomach is bloated. And he has to avoid heavy lifting. There's a review after 1 month with the dietitian for follow-up. Now let's move to the writing task. In the writing task, using the information in the case note, write a letter to the community health nurse for requesting home visits post-operative care needs. So for post-operative care needs, the community health center has to send its facility. The date of the letter is 8 January 2023 as usual, and community health center, the address is being given. Now let's move to the letter. Dear nurse, the name of the patient is James Mackay. He is aged 76. First, as you know that you have to write the purpose. So the purpose is home visits from community health center. So Mr. James Mackay requires home visits from your facility for post-operative care and management following his discharge today. He is recovering from partial gastrectomy. So first you will have to write the purpose for which you are writing the letter. Thereafter the disease condition, Okay, I believe you have understood. Now let's move to the other part. That is the body paragraph 1. Initially, Mr. Mackay presented to hospital with multiple complaints. So he had multiple complaints such as fatigue, stomach pain, indigestion and unintentional weight loss. Subsequently, a series of investigations were initiated. So, for diagnosing a particular disease condition, series of investigations are being done, and you needed specify each and everything. And for that, if you are writing to a doctor or anyone related to that field, you need to write the series of investigations which had been done. But this is for post-operative care, and in this particular type of letters, you needed write the or you needed specify the type of investigations that had been done. So a series of investigations were initiated which confirmed the diagnosis. So I have mentioned the diagnosis in the first paragraph itself, so you needed repeat it. On 26 December 2023, he underwent the surgery along with jejunostomy feeding pump fixation. Okay, so this particular pump has been fixed so as to provide the feeding of medication as well as food. Okay, now let's move to the second. This is the second body paragraph. Post-operatively, Mr. Mackay's condition was uneventful. Initially, he was nil by mouth, so nothing was given in the initial stage. Thereafter, his nutritional needs and medications were managed with the nasogastric tube. It is worthy to note that post-operatively liquid diet was commenced. So, post-operatively, he was a cancer patient, and solid food could not be given just after the surgery. So, he was given liquid diet to the nasal tube. Subsequently, small amount of soft foods were given. Just prior to the discharge, the urinary catheter along with the nasogastric tube was removed, and the nutritional and medications were delivered through the jejunostomy feeding tube. Okay, now let's move to the social history paragraph. Mr. Mackay is a widower and lives alone. His residential address for your reference has been enclosed. So as this is a home visit, you need to specify that the residential address is being enclosed. Now the discharge plan, that is the final paragraph. It would be appreciated if you could provide assistance in jejunostomy pump feeding until his calorie intake is satisfactory. Okay, so in this particular paragraph, what all needs to be done has been specified. Kindly assess the surgical site and drainage tubes. Please check for the signs of infection such as redness, odor, pain or swelling. Of note, he has a review appointment after 1 month with a dietitian. So he needs to be taken to a dietitian after 1 month. Okay, so this is the final paragraph. If you like the video, please do not forget to like, share and subscribe so that maximum number of students could benefit from it. If you want to join my coaching, you can contact 9961506123 for online and offline admission. So thank you for now.